Good evening, I'm Carly Robinson and welcome to City News Connect. Tonight, we take you behind the scenes of a program changing how emergency room doctors treat homelessness, a prescription of sorts for housing. The first of its kind bridge healing program here in Edmonton recently cleared a 2-year pilot. And early data shines a light on how it's working, both for the people going through the program, being discharged from hospital to housing, as well as for taxpayers, that it's saving the system money and freeing up emergency room space. Doctors and nurses have been sounding the alarm in Alberta. Long emergency wait times and a system under pressure.
There's a lot of moral distress in emergency amongst our nurses, our social workers, and our physicians, and even our residents and learners, when you know you could be doing more for a patient and you can't.
But since 2023, medical teams in Edmonton hoping to relieve some pressure, able to avoid discharging certain patients to the streets or shelter system by offering them a bed in transitional housing. The patient just needs to identify as homeless and answer yes to wanting to change that, and there needs to be a bed available.
They have their own bathroom, their own shower, their own private space, which is really great. It's usually the first thing people do when they come is have a shower. So
a clean space to call their own while they recover from whatever brought them to hospital, with a shared kitchen and a community space to connect with staff, there to help them find long-term housing.
And helping them to move forward in life, and you know, we can't force it on them, but you know, giving them a safe space to be, you know, safety is so needed out there.
Janice Ward knows what it's like to be homeless in Edmonton. A decade later, using her experience to help those staying at Bridge Healing.
So proud to be here and to have supportive people in my life and to help me turn things around. You know, I didn't know that they cared. I didn't know, you know, because all I cared about was me and my addiction. I was an addict, you know.
Saying beyond getting ID, applying for income support and housing, it's about showing those coming through the doors they deserve to find help.
You got support through Jasper Place Wellness Center. Yeah. What would it have been like though if you had had this?
If I had this, oh man, I would fight to stay here. When I first got my place, like they had gotten me places before, but I couldn't stay in my place. You know, I made a bed in the middle of the floor because I was so used to being homeless and coming and going and just making my bed anywhere or whatever. And took me 12 years to finally know that I deserve this. This is mine. You know, I deserve love just as much as anybody else.
The 3 buildings in Edmonton, with a total of 36 rooms, have been open for just over 2 years now. But the idea began with public health students at the University of Alberta and a longtime inner-city doctor.
We know that being diagnosed as homeless is increasing your likelihood of dying by 20% in the next 5 years. This is a serious issue that we need to deal with.
And so how many years have you been working specifically Royal Alex?
35.
Dr. Louis Francischetti works in Western Canada's busiest emergency department, Edmonton's Royal Alexandra Hospital. Data showing the number of ER visits from those with no fixed address counted as homeless rose steeply during and after the COVID-19 pandemic to more than 9,000 in 2024 at this hospital alone, with 1,000 more than the year before, with many patients coming back multiple times a year.
The reality you're seeing in the emergency rooms with the patients who qualify for bridge healing, what you've been seeing over the years with those who are coming, they're asking for help, and then would otherwise be discharged onto the streets.
The best way to describe it is on a typical winter morning when you go to work at 6 o'clock and you look at the waiting room, there's usually about 45 to 50 men and women, and they're covered in all sorts of tattered clothing. You can't see any faces, and they're just trying to seek shelter from the cold. And for a lot of them, they really don't need to be in the emergency department, but there is no other place for them to go. And we welcome them with open arms. But when you actually start talking to them and finding out what they need, They really don't need an emergency department. They need a system that would better address their needs, and that system doesn't exist.
Some people might think of housing and the healthcare system as separate, completely separate. But why is it important with this program to have that entry from the medical system?
Well, because it's a continuum of care, right? So if they're coming to emerge, it's because they usually are at the lowest of the low periods in their lives. Because remember, they've had to leave their limited possessions behind somewhere. They've had to go through security. They've had to, talk to an overworked nurse. They have to wait in the waiting room for, 8 to 10 hours to be seen. So they're really crying out for help. And it's an opportunity for us to continue the care we provide by providing that transitional housing, so they have a place to go, rest, recover, get away from their addiction to chaos, because their lives are very chaotic. They're in survival mode all the time. And then start their journey to recovery. Simple things that you and I take for granted: getting an ID, opening a bank account, starting to look for a place that you can afford to live, possibly going back and getting an education or finding a job. So it's really amazing to see how these men and women just blossom when they're given an opportunity to be human again.
So they get their own key for their unit.
The difference of this model noticed by staff.
We had a older gentleman in his later 60s, had been living in the River Valley for 22 years. And because of health complications, it wasn't feasible for him to live there anymore. So he ended up in our program and was able to get successfully housed. And he was so happy the whole time. It's like definitely being able to see him go from living rough for such a long period of time. And he honestly would tell us, like, I never thought something like this would be possible for me. So getting to see that and getting to be in that part of his journey was really great. Mm-hmm. So, and that's how it is with a lot of our clients, is being in a space where, again, it's built to look like a home. It's built to feel like home. Mm-hmm. It really helps. It helps them, be able to feel like, you deserve this. You're allowed to have this, and that really helps with the housing process. Because a lot of people, if you've been in a shelter for a long time, if you've lived in the city rough for a long time, you've been treated a certain way.
Chantal Jackson has worked in the shelter and housing sector for 5 years. She knows connecting housing with emergency rooms is making a difference.
Your experience with this is personal as well.
Yeah.
Can you talk to me about why you do this?
My father, unfortunately, was chronically ill for a long time and lost his housing because of his chronic illness and the lack of supports out there for him, and ended up passing in the hospital waiting for a permanent place to move to. And so when I see clients come here and they're in the same situation, I know that this program saves lives. I know it changes lives, because I know it could have, if that opportunity had been there for him, it would have, saved his life, right? So that's why what we do is so important, because it does affect people's lives. It does save their lives. It gives them opportunities that aren't available to them right now.
Next on City News Connect.
That's more people that we can get back on their feet by simply giving them some basic support.
The impact beds like these have on the medical system. We break down the numbers that doctors say points to success. From encampments to shelters, Edmontonians have seen an increase in the number of homeless in recent years, with data showing an increase in those living rough. The numbers from the emergency room alone shows that across the Edmonton Health Zone, over 6,000 patients with no fixed address showed up to the ER, over 21,000 times in 2024, which is where Bridge Healing comes in.
Ashley, you're the general manager. For people who don't know, just tell me what happens in this building here for Bridge Healing.
When people are accessing our emergency departments and they're utilizing it simply because they have nowhere else to go, rather than doing a quote-unquote treat and street, as they say, we give them an alternative where they can come here, We give them a safe space. We give them a room with a lock on it, which a lot of people don't have or haven't had in a long time, food, and rest, so that they can recharge and then start working on what it looks like to move forward in their life.
Jasper Place Wellness Center General Manager Ashley, who asked to go by just her first name for personal reasons, says it's important to keep the building as welcoming as possible, to give a space that feels like home and a private room.
This model is working because it's really hard to connect with clients when they're still accessing those shelters or you're trying to get them outside. And you know, most of the time when they're outside, they're in survival mode. They're trying to figure out, how are they going to eat today? Where are they going to get a warm pair of clothing? They're not thinking, oh, I have an appointment with my worker at 2 next week on a Tuesday. So having a central location where they have that time to, again, recenter has been completely game-changing.
For patients discharged from hospital to housing here at Edmonton's Bridge Healing, it gives them time, a room to call their own, while social workers start helping them in finding long-term housing, or depending on where they're at, access to detox or a wait list for mental health and addiction supports. And a recent review from the Alberta Medical Association found those who went on to permanent or supportive housing after this had a significant drop in emergency room visits by as much as 75% in the following months.
And you've got to understand why that's important, because most of the time they take an ambulance to go to emergency, which means that an ambulance is not available on the streets. And then they get to emergency where they really don't have to be, so it ties up a bed and it ties up resources in the emergency department as well.
And the numbers show the province renewing investment in bridge healing is saving money. An average trip to the emergency room costs the healthcare system around $1,400. Increase that to $7,500 if you're admitted to hospital. With a 75% reduction in follow-up hospital visits for someone housed through bridge healing, you're looking at an estimated $467,000 in savings. With 36 rooms, the possibility of $5 million saved in a single year.
This problem, as we mentioned earlier, is getting worse. It's not getting better. And so we have to come up with solutions that are meaningful at a fraction of the cost of what other solutions are. So when we build a bridge healing building, every bed will cost about $120,000 to build, versus most other folks that are building these buildings are building them at $400,000 to $500,000.
Well, the goal is to get patients through the program into long-term housing. It's not always the case. Only around 20% of clients in the first year left for housing. Others returned to hospital, left the city, or checked out on their own.
Even if they don't leave here quote unquote successful into housing, they can leave here a little bit better than when they came. So even if they just have ID, having ID opens so many doors, and having income again opens so many doors, including getting food or maybe a new pair of socks.
And we accept patients 24 hours a day, and we're very low barrier to entry. So we're not cherry picking the simple patients. We're accepting, you know, the majority of the patients to the facility, which is very unique. We'll accept patients that are on oxygen. A lot of other places don't. If patients happen to have, you know, lice, we'll accept them and, you know, treat them as well. So it's very low barrier entry, and a lot of other programs aren't like that as well.
The reasons for a homeless patient to present to the emergency room are vast, from chronic health issues to frostbite or heat exhaustion, addictions or overdose, viral illness, or those just looking to escape the elements. The team at Jasper Place Wellness finding some of the homeless patients who end up in the emergency room have never interacted with the shelter system.
So with Bridge Healing, what's unique about it is when it was built with the thought of community in mind. So the common area, the kitchen, dining area, living room is all shared space, while they have the privacy of their own room and their own bathroom.
Site manager Chantel Jackson stressing how the natural light and open space isn't common in other transitional housing she's worked at. With 2 floors of bedrooms, the first floor gives a space to connect with staff and each other, and a large kitchen.
And getting to share the space, and we've had so many people find their love of cooking again here, which has been great. We had one gentleman start making pies again, and he for the whole house, and he loved that. So it's been really good. You know, they usually when the house is full, the clients make breakfast together or they'll make supper together.
Jasper Place Wellness is in the process of reopening a health clinic for the vulnerable, hoping by giving access to a family doctor, they can take more pressure off the emergency room.
Why is that important right now to look at different ways?
Because the old ways haven't been working. They have for some, which is absolutely wonderful, but it's like if I were to take my shoe off and hand it to you, I doubt it's gonna fit. It is not a one-size-fits-all. So having different modalities for people to access and different access points across the city is huge. It gives more opportunity to the community that is maybe not knowing how to reach out to have that, specifically our seniors. Because we do have a lot of seniors in our community that are experiencing homelessness that worked for 40 years, but they just don't know how.
Still to come. Reconnecting with community.
Believe in themselves, that they deserve this.
How a helping hand through the healthcare system relies on community support to help the vulnerable, and the push to expand the program for the growing demand across the province. Three buildings, each 3 stories. Might be easy to miss if you're driving by in West Edmonton, but the stories of homeless patients leaving the emergency room in Edmonton looking for a fresh start stick with the staff at Jasper Place Wellness Bridge Healing.
Had an individual come to us. He had a lot of developmental disabilities and he was being horribly victimized in the shelter systems. They were taking all of his money and he was oftentimes getting beat up. And when he got here, first he was a little bit nervous because he didn't know what he was getting into. And we ended up keeping him for quite some time because we just couldn't let him go back out in the street because we were told he had 30 days. So we held on to him for about 8 months until he was able to get into a group care facility where he is happy and he is thriving and he calls and checks in on us all the time. When you treat people like people, they're able to flourish, right? If you give them the opportunities, if you believe in, give them that autonomy back, then they're able to flourish and focus on their goals. They're able to accomplish what they want, and which is something like I'm able to just go out and do, and that's something everyone should be afforded. You know, Jasper Place is built on the belief that housing is a human right. Doesn't matter where you are in life, that you should be able to have a roof over your head.
Trusting people and they're giving that hope that's a big step, to finally believe in themselves, that they deserve this, they deserve to be off the street.
Alberta recently recommitted to funding the Bridge Healing program here in West Edmonton with $1.8 million over 2 years from the Ministry of Seniors, Community and Social Services. But it's a model Dr. Louis Francischetti hopes will grow to more cities with community support. Here in Edmonton, the city donated the land as well as initial startup grants. And everyday Edmontonians helped make it a reality with donations to the Royal Alexandra Hospital Foundation.
Just seeing how people come together and work together, I love to try and make complicated things not so complicated. Once somebody called me an iconoclast and I didn't even know what that was, and I looked it up, and it's someone who likes to take things apart and put them back together better. And so the joy comes in seeing the credibility of a foundation stepping up and saying this is an important issue. So once the foundation steps up, then other people go, wow, if it's good enough for the foundation, it should be good enough for me to donate.
When Bridge Healing opened in 2023, originally funded by Alberta Health Services, it gave an opportunity to test the model, finding that beyond the stability of a bed and a chance at long-term housing, it gave patients a connection with community.
That's the brilliant nature of the healing houses, is they're designed so that people actually start becoming almost like an instant family and supporting each other. And you need less staff for that as well. So it's a very brilliant model that we've been able to develop that's now available for other communities to follow if they want. Mm-hmm. And there's no reason. And the Premier herself has said we should have this all across Alberta. And so there's no reason now that Calgary can't do it, Lethbridge, Fort McMurray, Medicine Hat.
Just when you see people in the community that are experiencing homelessness, they're still human. and they deserve to be treated as such. And it's important that we remember half of Albertans are one paycheck away from being in the exact same position. So as easy as it is to look down on them, maybe hand them a pair of socks. That's what I do.
On most days, the 36 beds at Bridge Healing are full, meaning the timing has to be just right for a patient to be in the ER when a bed opens up. But for Janice Ward, knowing what it's like to be homeless, she sees this facility as an opportunity for hope.
You know, just for anyone who's stuck on the street, you know, to, you know, like reach out and be able to, you know, like, you're in the hospital, go to the hospital, you can talk to the social worker to get into these places, and that there is real hope and real help out there, and we need real people that you know, want to, you know, I don't know how we're going to reach the helpless and the hopeless and that, but you know, with places like this, there's hope.
That's it for this week's City News Connect. If there's something happening in the community you think we should know about, head to edmonton.citynews.ca and click on the Contact Us. We'd love to hear from you. I'm Carly Robinson. Have a good night.